Hi, I'm Liz, your friendly neighborhood nurse, and let's talk pediatric patients. I work at a rural hospital, so I take care of pediatric patients and adult patients, and we don't have a pediatric intensive care unit. When it comes to pediatric patients, especially with respiratory kids, we really focus on work of breathing. When we say work of breathing, we mean how hard are they working to breathe? Are you seeing retractions, substernal retractions, retractions up here? Are they nasal flaring? Are they belly breathing? How fast are they breathing? Kids do a really good job of compensating until they don't. So you can have a kid that's coming in for RSV and they're working really hard to breathe, breathing 70 breaths per minute. Oxygen saturation is like 95%, and you're like, oh, this isn't really matching what I'm seeing. And that's because it's not. The kid is working really hard to breathe, and they can't do that forever. They get tired, and once they get tired, their body just cuts off. They're like, I'm done with this, and then they crump. It's your job as the nurse to be paying attention to how hard they're breathing, how fast they're breathing, how they look. Are they sitting there just lethargic on the bed? Are they moving around in the room? Those things are going to be indicators to you that you need to either intervene or continue to monitor. Some things that we can do to help with their work of breathing is make sure that we're suctioning out their airways, a little bit of saline, suctioning it out frequently to make sure that they have a nice clear airway. We can try high flow. High flow helps a little bit of pressure to help expand the lungs so that they're not working as hard to breathe, and also making sure that they're hydrated, and if they have any underlying conditions of any bacterial issues, getting antibiotics on board, and also steroids to help decrease the inflammation in the lungs. Just remember that with pediatric patients, even if their saturations and all of their vital signs look relatively okay, if you look at them and they look bad, you need to intervene so that you can make sure that this kid doesn't decline. Follow along for more new grad RN tips. Bye!